Are you scared of your 12-hour shifts? Well, here are some things to make your shifts go by faster. Well, the first thing is time block. I used to work 12-hour shifts, and those could be really, really draining and very scary, especially when you're first starting out. And time blocking saved my life. Let me let you know, I would time block 4 times per shift. I would time block 7 to 10, 10 to 1, 1 to 4, and 4 to 7. And it made my shifts go by very quick because I knew exactly what I needed to do within each time blocked. Well, the next thing I'll let you know is your first 20 minutes matter a lot in your shift. So within your 7 to 10 time blocked bracket, you need to take the first 20 minutes to go over your patient's chart. Now that is non-negotiable. You need to know what labs are back, what results are back. Do I need to put in any new protocols, electrolyte protocols? Do I need to watch out for any tests that's going to be conducted throughout the day? If your patients are going for dialysis, you probably want to make sure that, okay, can I give them the medications first before they go, or am I holding medications? That way you're not starting off in the wrong patient's room when you have someone that's just about to go for dialysis. Okay, the next thing to do is bedside shift report. Now, I cannot emphasize bedside shift report. Bedside shift reports helps your life. Like, I know everyone doesn't like it, but it actually saves you because guess what? You get to set expectations in your patient's room. When I go in there, I put on my name on the board, and then I say, hey, do you have anything I can do for you right now before I leave, or do you need anything before I come back? Because I don't want to be giving medications and someone is asking me for water or someone is asking to go to the bathroom. If that could have been avoided, I'd rather take care of that and focus on medications. I used to have 6 patients in the med-surg unit, and I would prioritize finishing my medications by 9:30 a.m. so that way I actually have time to sit back and connect the dots on what's going on with each patient. So that way I'm actually getting to use my nursing clinical judgment skills to coordinate the rest of my day, and I'm not running around like a headless chicken because it's very easy to just keep running around and then you go home feeling, unsatisfied. You feel like you didn't help any patient. You feel like you were just out here giving medications and fulfilling doctor orders compared to actually going through the chat and being there for the patient and providing the care that you know how to provide best. The next thing I would say, and I don't take this lightly, is delegate. You need to delegate to your CNAs or your PCTs. As a new grad, I struggled with delegating because I felt really small. Because I'd have all these CNAs and PCTs that were like double my age, and I really felt off asking them to go do stuff for me. But guess what? It is within the scope of practice, and you're doing yourself a huge disservice doing both your job and your PCT or your CNA's job, because guess who suffers? Your patient, because you don't have time to spend with them. You don't have the time to care for them.